Almost always we can and we do. Infection is not a deterrent for immediate placement. When a patient comes like this, the last thing he wants to hear is that you cannot place the implant right there and then you have to do bone graft and come back afterwards. It's just a poor patient service. You can see the periapical infection going on for tooth number 4. That's never a problem. We take the tooth out, we clean the granulation tissue. The problem with the infected area is that its pH is a little bit on the low side. We use the natural buffer, which is sodium bicarbonate. We put a cotton soaked with sodium bicarbonate in the area that was infected, leave it there for 5-10 minutes, and that should take care of the lower pH. And then go put the implant the regular way up, and we measured the steadiness of the implants with the periostat. They were both negative. One was minus 2.8, another minus 3.5. I decided to wait another month. I'm pretty sure in a month's time it'll be minus 4.5 or less. So we placed the implants in May, and now it's August. It's been about 4 months, and the infected area has filled with native bone. It's ready to be restored. But I'll wait another 1 month also, since the numbers right now are minus 2.8 and 3.5. I want to see it a little bit less, like minus 4.5 or less.